The Identification and Differentiation of Warm Diseases is a work by the Qing Dynasty medical expert Wu Tang. Chapter 2, Upper Burner Section. Section 16. Translated into Contemporary Mandarin Chinese, Part 1, 16. Tai Yin warm disease refers to a condition characterized by a mix of cold and heat symptoms. In such cases, sweating therapy should not be employed. If sweating therapy is mistakenly used and fails to induce sweating, it will inevitably lead to rashes on the skin. Excessive sweating might result in a patient becoming confused or unconscious. For cases with rashes, the Hua Ban Decoction should be used for treatment. If skin eruptions occur, Yinqiao Powder can be used with the omission of soybeans, and instead adding processed Rehmannia, Moutan bark, Daqingye, and Beiqianliguang for treatment. However, it is important to avoid using herbs like Shengma, Chaihu, Danggui, Fangfeng, Qianghuo, Baizhi, Gegen, and Sanchunliu. In the case of unconsciousness, Qinggong Decoction can be employed. Additionally, formulas like Niuhuang Wan, Zixue Dan, and Zhibao Dan can also be used for treating this condition. Patients with Tai Yin warm disease are typically unsuitable for sweating therapy. The disease arises from invasion of wind cold or wind heat through the mouth and nose, and the pathogenic factors might not necessarily directly attack the sweat glands of the Tai Yang meridian. Thus, it's not advisable to affect the sweat glands of the Tai Yang meridian. At times, due to a lack of understanding of relevant knowledge, doctors erroneously administer sweating therapy. For instance, if a patient has internal heat accumulation and blood dryness, and cannot reduce heat through evaporating sweat, the pathogenic heat will remain in the skin and blood, leading to rashes on the skin. Another scenario involves patients having a good surface looseness but excessive sweating. Since sweat is closely related to the heart's fluid, excessive sweating depletes yang qi, damages the heart's yang, resulting in confusion, and even stroke. Impairment of heart yang leads to inadequate heart blood, and as the heart is primarily yin-driven, if heart yin cannot nourish heart yang, excessive ascension of heart yang ensues, causing mental unrest. Additionally, there's a phenomenon that is scarcely understood, the reverse transmission of the Han-Tai Yin meridian. When treating diseases of the Han-Tai Yin meridian, one must comprehend that it will inevitably influence the Han-Ju-Yin pericardium meridian, as these two meridians are closely connected and impact the circulation of qi and blood. The composition of the Hua Ban Decoction is gypsum 1 liang, anamarina 4 qian, raw licorice 3 qian, platycodon 3 qian, rhinoceros horn 2 qian, white glutinous rice 1 he. Boil 8 cups of water, take 3 cups, divide for thrice daily intake, then boil the dregs with water for evening consumption. This formula is mainly used to combat internal heat pathogen, following the principles of salty cold treatment and supplemented with bitter and sweet methods for regulation. Previously, doctors often used Wu Tang as a substitute for the Hua Ban Decoction. This is because Wu Tang is suitable for Yang Ming patterns. Yang Ming governs the muscles, so rashes on the skin tend to spread throughout the body, from the inside out. Therefore, gypsum is used to clear heat and reduce fire, anamarina is used to clear metal cold pathogens, protect the lungs, and treat high fever in the Yang Ming region. Licorice clears heat, detoxifies, and harmonizes, while glutinous rice clears stomach heat, protects gastric fluids, and corresponds to the dry heat characteristics of the Yang Ming organs. In this formula, ginseng and rhinoceros horn are added as ingredients. Rhinoceros horn is bright red. If there's excessive wood and fire attributes in the body, red rashes can spread rapidly. However, if using medicines that dry metal as in Wu Tang might not be sufficient to clear the upper burner, hence the need to add ginseng to invigorate kidney qi, transfer it to the lungs to maintain the circulation of water and heavenly qi, preventing depletion of bodily water. Rhinoceros horn has a salty-cold property, carrying the energy of wood, water, and fire in mutual generation. It is considered a rare creature with potent yang energy, suitable for treating various toxins, parasitic diseases, pathogenic influences, and malaria. Its salty-cold nature can regulate kidney water to nourish heart fire, facilitating the outward movement of skin lesions while suppressing poisonous influences and preventing epidemics. When red rashes on the skin recur, the issue isn't merely the imbalance of internal qi, hence the addition of 2 cooling blood herbs. Based on Yinqiao Powder, adding Rehmannia, Moutan bark, and Daqingye enhances the heat-clearing properties. Soybeans are omitted due to their warm nature. Additionally, following Wu's approach, the Zhibao Ban decoction can also be used for mixed rashes, as skin eruptions are prevalent in warm diseases, while red rashes are less common. In summary, red rashes might arise from imbalanced qi and blood, or relate to the muscles, necessitating different herbal formulas for treatment. Raised red spots on the skin, as well as measles and eczema, pertain to blood vessel issues, hence requiring herbs with aromatic and blood vessel penetrating properties, pungent and cooling to release muscles, and sweet and cool to clear blood. About the prescription of the Zhibao Ban decoction, which includes warming and drying herbs like Danggui, Shengma, Chaihu, Baizhi, and Chuan, why not worry about further roasting the body fluids? Moreover, ancient theories about treating warm rashes with warm or cool tonics are indeed valid. Furthermore, warm rashes are more severe compared to childhood wind heat rashes. The intention behind using herbs like Chaihu and Sheng is to promote upbearing, but it's unclear whether warm diseases are more common in spring and summer when the qi of heaven and earth rises without descending. Is it appropriate to once again use upbearing herbs for upbearing in such a situation? Ancient classics record, in winter, store essence and qi, so that warm diseases won't arise in spring. This means that those with warm diseases already have unstable lower burner essence and qi, so how can we further elevate their Shaoyang qi, leading to depletion in the lower burner and excessive rising in the upper burner? There's a saying, no solid without hollow. One must conform to the qi of the season and not go against the natural order. Shouldn't we understand this point? However, later generations tend to imitate blindly without carefully reading the classical literature. Furthermore, at that time, if someone exhibited an exterior warm condition and after 2 or 3 days of no sweat, it was termed hidden rash. It required not only the use of herbs like Chaihu and Qianghuo but also the addition of Sanchunliu to promote outbearing. However, people didn't know that Sanchunliu blooms 3 times a year, hence its name Sanchun, 3 springs. Some mistakenly thought Sanchun referred to mountains and rivers. In reality, ancient people referred to the willow tree as Chengmu, just like in the poem it's Cheng, it's Mu. Sanchunliu is extremely pungent, warm, and drying in nature. It grows rapidly with many fine branches, penetrating into the channels and collaterals. It's specialized in treating deficiency cold white rashes, such as red rashes caused by boiling hot qi and blood in warm diseases. Doesn't it seem like seeking revenge? Skillful doctors in treating warm diseases fundamentally don't necessarily need to induce rashes on the skin. Even if pathogenic factors stagnate, after 2 or 3 days or even 5 days without sweating and a tendency for no rash, pungent and cool herbs can be used. For severe cases, the dosage can be increased, while for milder cases, it can be reduced or omitted. If only pungent, warm, and drying herbs are used, pathogenic heat will invade the body and lead to heat toxins in the blood. Isn't this self-creating rashes on the skin? Doctors often relax once rashes appear, thinking the problem is resolved. However, when pathogenic heat is vigorous, that's precisely when utmost caution is needed. Slight negligence can lead to serious consequences. To be continued.